Level
So you're talking about the hemoglobin level, are you? Or there's different levels on that full blood count, but the hemoglobin's your level of your red cells, and it's not uncommon for well, certainly a diagnosis. Your CML itself can cause an anemia, a reduction in your red cells. But these drugs can also suppress the bone marrow a bit where you are a little bit anemic, and it's of no consequence in terms of your outcome.
Will that play much of a part on how I would progress?
Look, it's hard to know because it depends which drug and which, what the timing is in terms of your disease and things. Yeah. So in terms of Tasigna, there is not there's not a lot of data out there for what happens if you take less than 300 milligrams twice a day. So the trial was 300 milligrams twice a day or 400 milligrams twice a day. Yeah. Well, certainly most of those curves that I showed you are with 300 twice a day. So it's sort of it's a very common dose for Tasigna, and it's not clear that that's any worse or better than 400. It seems to be. No, so the trials and the way that we do it is just stop it. So you just stop the drug, and then you have to, as say, you could only do that if you're in that small patient group where it's low enough, and if you religiously have a BCR-ABL level done monthly for a year or 2 monthly for another year.
And is it your experience that your patients have suffered any side effects from seizing it all at once?
No. I think it's the most important thing. So I think that these drugs work in the vast majority of people if you take them. If you don't take them, they don't work, funnily enough. And they seem to. There is data with some of them. So Gleevec, that if you take less than the recommended amount, that your response isn't going to be as good. And certainly, anecdotally, from my experience, the people who have progressed, most of them, it's been because they haven't been taking their pills as they should have. And so I think that compliance is the number one, or non-compliance is the number one reason for progression. There are clearly people who progress who are magically compliant, but they're probably the commonest cause for progression, I think, is not taking the pills as much as you should, missing doses, having drug holidays, that sort of thing, which we don't recommend really any of that. Really is the data is for people who take it, fairly religiously. Obviously, we're all human. We're all going to miss a dose here and there, but as long as it's only very infrequently here and there, then I think you're right.
Does the side effects ever reduce?
So yes, so all the trials have shown that there are more side effects when you start on the drugs, and then they get less as you go along. Some of that is that they get less, and some of it is that you get used to them. So you get used to managing them. So there are some that seem to go away over time. There are undoubtedly some side effects that people continue to have, while they're on these drugs. As I said, we appreciate that. So we know it's not a picnic, but compared to the alternative, usually we can sort of manage them.
Or they don't want to do it. Is that significant as well?
Yes, I think so. I think at any stage of the game. So, the people that we've had progressing that have been unexpectedly progressing, so have got down to good levels on the drug, and as I said, it's because they sort of start to sort of try and fiddle the doses a bit and only, take it 5 out of 7 days or whatever, and so I think it is, unless you're lucky enough to be in that small percent that can actually try and stop it, most people are going to be on these drugs for life. And it does seem that you need to be on them for life, as in it doesn't seem that there's any ability to reduce the dose or frequency as you get along. It sort of seems that that dose is the dose which is required to suppress the drug, suppress the leukemia. So it's not clear that whether it's a sort of just a lack of suppression by not taking the doses, or whether it's a bit like, antibiotics, you go off it and on and off and on and you become resistant to it. I think it's probably more just a lack of appropriate suppression by taking the drugs, and if you, as I said, if you the more you suppress the leukemia, the less chance it's got of coming back, and that so I think it is more just a direct suppression effect rather than a going off it and on it increases your risk of mutations. Yeah, so certainly skin rashes, the big thing is they're often sun associated. So stay out of the sun, wear sunscreen is sort of the biggest one. Sometimes patients need steroid creams and things, and that can be useful as well. That's probably the main issues for rashes. Sometimes if it happens early in the course of the disease, sometimes you need to stop the drug for a while and things like that, but only in the setting of that being very clearly dictated by whoever's looking after you. So yeah, clearly dry skin is problematic, and look, I guess it's just trialling different types of moisturising type cream to see if it can help. There's sort of, I guess, two main types of moisturising cream, if you like. There's aqueous type cream, which is more of a cream that you let your skin try and sort of absorb, if you like, versus barrier creams, which is just like oily type creams that sit on the surface and try and retain whatever moisture your skin produces. It's often just trying a different combination of those. The other common side effect with some of the drugs is nausea and diarrhea, and sometimes that can be helped by adjusting how you take it in association with diet. Some of the drugs to Cigna you can't take it with food, but some of the other drugs where it doesn't matter, you can be helped by taking it with food and you get less nausea. Sometimes again in conjunction with your haematologist, you can split the doses a bit more, so you can take Gleevec twice a day instead of once a day or something like that, and it can sometimes help with the nausea.
And tips for fatigue, because people complain about that. So,
Yeah, fatigue's the thing that we're the least good at treating as doctors in general, but for all our diseases. But I guess the gentle exercise is probably the way that I sort of the first thing I generally recommend is that it sounds counterintuitive in that you're tired and you've got to go out and sort of go for a walk. But if you do that regularly, then it does seem to be the thing that can often improve your fatigue levels. Other than that, it's sort of it's a difficult symptom if it's there. Yes. So I guess all of us, that happens. It's just an exaggeration of what happens to all of us in terms of episodic, tiredness. But yes, in terms of there does seem to be a dose effect for a lot of these symptoms, and so there is some ability on some of the drugs to reduce the doses and to avoid symptoms. We always do that very cautiously, and it depends on where you are in the stage of your disease and what level your disease is at. Again, I only would do it in conjunction with your doctor, but there is sometimes an ability to. Thanks, Bob.